Bismillahirrahmanirrahim. Assalamu alaikum. I Dr. Javed Iqbal Malkani. There will be discussion about interpretation of arterial blood gases. Today we will discuss about arterial blood gases in detail. First of all, definition: acidemia is pH below normal less than 7.35 and alkalemia is pH above normal greater than 7.45. And acidosis and alkalosis is pathological process that cause increase or decrease in hydrogenine. Increase in hydrogenine will lead to decrease in pH and decrease in hydrogenine will lead to increase in pH. Procedure and precautions. Ideal site for sampling is radial artery and brachial artery, femoral artery, and the sample syringe should be heparinized with 0.5 ml heparin. Don't leave excess heparin in the syringe because excess heparin cause dilutional effect will lead to decrease in both bicarb and PCO2 during interpretation. Only small 0.5 ml heparin for flushing and discarded. Syringe must be filled more than 50% blood and use only 2 ml or less than 2 ml to avoid air bubbles. Ensure no air bubbles in syringe because if air bubbles is equal to having PO2 150 mm and PCO2 0, so if air bubble is in blood, it will lead to increase in PO2 and decrease in PCO2, and sampling should be taken in cold chain. Early analysis must be done because any delay in analysis will lead to false interpretation. If delay in every 10 minutes, pH in ice sampling and unice sampling, there will be greater difference. You can see in picture, and PCO2 1 mm and 0.1 mm. How to interpret ABGs? There are basic steps we will follow in this video and will completely discuss interpretation of arterial blood gases. Basically, first of all, you have to know about pH, HCO3 and PCO2. So pH hydrogenine increased, pH will be decreased and vice versa. So regarding acid base, there is first simple acid base disorder without compensation, and there is with compensation, and third one is mixed acid base disorder in which more than one acid or base disorder. This is a mnemonic in which ROME, ROME. ROME is about respiratory opposite and metabolic equal. It means in respiratory two things will be monitor and pH and PCO2. And respiratory process both will be in opposite direction. In alkalosis, pH will be increased, PCO2 will be decreased. In metabolic, both parameter pH and HCO3 will be in equal direction. So first of all, look at pH. pH normal range is 7.3 to 7.45. So if it is less than 7.35, then acidosis, and in alkalosis it will be more than 7.45 as normal range is 7.35 to 7.45. So first of all, we will see about pH, and then after pH, second step is PCO2 or HCO3. If PCO2 is increased or decreased, there will be respiratory acidosis or alkalosis. If HCO3 is increased or decreased, there will be metabolic acidosis or alkalosis. So after pH, second step is you will see about PCO2 or HCO3. So let's suppose if pH is less than 7.35, it is acidosis. Second step is to look at PCO2 or HCO3. If PCO2 is increased, it is greater than 45, then respiratory acidosis, and If HCO3 is decreased, then it will be less than 20 metabolic acidosis. So pH is less than 7.35, it is acidosis. In respiratory acidosis, PCO2 will be increased, and in metabolic acidosis, HCO3 will be decreased, other parameter will be normal. For example, pH in first scenario is 7.30, which is decreased, it means acidosis, and PCO2 is 55, which means increased, and HCO3 is normal. So PCO2 is increased more than normal range, it is respiratory acidosis. In the second scenario, you can see HCO3 is decreased and PCO2 is normal, so it is metabolic acidosis with decrease in pH. pH is more than 7.45, it is alkalosis. Next step is either it is respiratory or metabolic, so we will see at PCO2. If PCO2 is decreased, it means it is respiratory alkalosis, and if HCO3 is increased greater than 28, then it is metabolic alkalosis. So after pH, we will see PCO2 or HCO3, and they will decide about either the process is respiratory or metabolic. In this example, first scenario, pH is 7.50. In both scenario, pH is more increased, so it is alkalosis, and in the first scenario, PCO2 is decreased and HCO3 is normal, so respiratory alkalosis. In the second scenario, you can see PCO2 is normal range but HCO3 is increased, so it is metabolic alkalosis. So next we will again revise. In metabolic, decrease in pH is acidosis and increase in pH is alkalosis. In metabolic, both parameters will be in same direction as from mnemonic. Rumi or O mean respiratory mean opposite. In respiratory acidosis and alkalosis, both parameters are changed in opposite direction. In metabolic, ME, it mean equal direction. If pH is decreased, then HCO3 is also decreased, and alkalosis in metabolic, pH increased by carb will be increased. And respiratory acidosis, decrease in pH, increase in respiratory acidosis, increase in PCO2. So here you can see in respiratory acidosis, pH is decreased and PCO2 is increased, HCO3 is normal, and same in respiratory alkalosis. You can see metabolic acidosis, pH is decreased, PCO2 is normal, HCO3 is decreased, and metabolic alkalosis, pH is increased, PCO2 is normal, HCO3 is increased. So in respiratory, you will see about PCO2, and in metabolic process, you will see about HCO3. First thing is to look at pH. Is pH is decreased, it means acidosis, and pH is increased, it means alkalosis. Second step is to look at PCO2 or HCO3. So here you can see, as I discussed already, respiratory Rumi from mnemonic, and respiratory, two things, PCO2 and pH will change in opposite direction. If alkalosis, pH will be increased, PCO2 will be decreased, and opposite in acidosis. In metabolic, both parameter pH and HCO3 will change in same direction. In metabolic, now we will discuss about compensation. Always remember, in metabolic process, there is compensation by respiratory system. If metabolic acidosis, there will be increased respiratory rate, PCO2 will be washed out, and so ABGs, PCO2 will be decreased. In metabolic alkalosis, there will be should be PCO2 increased. In respiratory process, in respiratory either alkalosis or acidosis, their compensation will be renal. In respiratory acidosis, renal excrete more hydrogen ion, and alkalosis, renal excrete more bicarb to decrease pH for compensation. So time for compensation and respiratory compensation for metabolic acidosis or alkalosis is very fast. It took 12 to 24 hours, while renal compensation for respiratory process is slow. It took 3 to 4 days for metabolic compensation. So this is very tricky. This must be memorized. Metabolic acidosis, as we discussed, for metabolic process compensation is by respiratory system. So in metabolic acidosis, PCO2, I calculate PCO2 by this formula 1.5 multiplied by HCO3 plus 8 plus minus 2. I will give example in the next. Metabolic alkalosis, PCO2 increased by 7 for each 10 mm increase in bicarb. And respiratory acidosis, acute or chronic. In acute, compensation will be by increase HCO3 by 1 for 10 mm increase in PCO2, and for chronic, HCO3 increased by 3.5 for each 10 mm increase in PCO2. For respiratory alkalosis, acute or chronic, in acute cases, HCO3 falls by 2 for 10 mm increase in PCO2 and decrease in PCO2. For chronic, there will be fall in bicarb by 4 for each 10 mm decrease in PCO2. So main thing to memorize is for metabolic acidosis, alkalosis, there will be compensation by respiratory system via PCO2, and for respiratory acidosis, alkalosis, compensation by renal via HCO3. So metabolic acidosis, PCO2 will be calculated by this formula, and for metabolic alkalosis, PCO2 will be increased by 7 mm for each 10 increase in serum bicarb. As metabolic acidosis is more common, so in this scenario, pH 7.25, PCO2 is 26 and HCO3 is 12, so all parameters are decreased, so it means it could be metabolic or respiratory acidosis. But when we calculate expected PCO2 by formula 1.5 HCO3 plus 8 plus minus 2, so plus minus 2 in this scenario, expected PCO2 is 26. It means 24 to 28, minus 2 26, 24, and plus 2 and 26 will be 28. So if it is this is so compensated metabolic acidosis. But if it will be more than 28 in this scenario, then this will be also respiratory acidosis. But if less than 24 PCO2, then it will be respiratory alkalosis. So again I repeat, for metabolic acidosis or alkalosis, compensation will be from respiratory system via PCO2, and if metabolic acidosis, PCO2 will be washed out, PCO2 will be decreased. For metabolic alkalosis, respiratory system will retain PCO2, PCO2 will be increased in compensation. And for respiratory acidosis or alkalosis, compensation will be from renal system. Thank you.